Some statistics about autism. 1% of the world's population is autistic, which is about 75 million people. Currently, 1 in 100 children worldwide are diagnosed with autism. Autism is no longer a male-dominated neurology. The intersectionality of autism and gender is more understood and included in diagnostic testing, resulting in more accurate assessments. All races, ethnicities, genders, and ages are affected.
Right. And it's imperative for providers to understand that autism is not on a linear spectrum. We're understanding more and more that it isn't a high to low functioning sort of thing, though classifying that way makes it a little easier to apply various constructs and treatments. Instead, we want you to think of autism as a pie. The pie pieces are not all the same size, and the size also tends to change at any given time. Needs and strengths vary day by day and even hour by hour. The ability for an autistic person to function is not static. So take a look at the picture on this slide. Today, a patient might be fidgeting a lot, might walk strangely, doesn't make eye contact, or appears angry. They don't show overt signs of depression. They have some animation in their voice, and they ask questions a lot, but they do appear to engage. Tomorrow, or even an hour from now, that same person's symptoms could look something like this picture. By making the assumptions that because the autistic patient could do something before that they can't now, that they're faking or lazy or not trying hard enough, is completely wrong and very, very harmful. Indeed, autistic people are often viewed as lazy or uncooperative, when actually it's quite the opposite. You'll hear us talk about ableism throughout this presentation. In short, however, ableism means that because I can do it and it's no big deal to me, you should be able to do it, and since you don't, you won't. So you're lazy because I would be lazy if I were doing what you're doing. Ableism works in other ways too, which we'll get to soon. But in the present example, it's important to know that the view of an autistic person as lazy or uncooperative is often due to ableist interpretations. They aren't lazy or obstinate. More often, their autistic brain that could do something a little bit ago might not be able to send those messages right now. They may be overloaded with stimuli, fear, or rumination such that they cannot perform as you expect them to. And the more you expect them to, the less they'll be able to. This tends to produce unintentional harm. Other factors to consider when working with autistic people, besides that each has different abilities at different times in different situations, is that very apt statement by Stephen Shore. He says, when you've met one autistic person, you've met one autistic person. And this is because autism affects each person in very different ways, producing varied skills and experiences. Remember, autism isn't along a scale, but it is binary in that either one has it or they don't. It's about the brain. Structurally, it's nature, not nurture. So to reiterate, autism affects each autistic person in different ways, producing varied skills and experiences. Remember that autism isn't along a continuum, nor is it static. It's dynamic. Nor is it a disease, so it can't be cured. Rather than being a puzzle to be solved, autistic people can bring a richness to many situations, a unique perspective that's usually quite valuable. So keeping this in mind, and on the way to talking about the three main areas of developmental differences, let's first take a brief look at the possibility of autism as its own culture.
Autism is recognized as a culture by autistic people. This is because autism is a unique neurotype. Autistic people think, communicate, and experience the world differently than non-autistic people. Understanding autism as a culture is an important part in supporting autistic people. So culture is defined as a particular way of life for a specific set of people. It comprises its own beliefs, institutions, etiquette, mores, and norms. Autistic people have a diverse communication style. They can be extremely literal, blatantly honest, don't enjoy small talk, and use as few words as possible. Many autistic people have social needs that are different than the mainstream society. They may avoid crowds and go to an amusement park on a dreary day. They may enjoy a small group of friends with meaningful conversation, and they may enjoy sitting in comfortable silence. Or they can be extroverted and enjoy being with a lot of people. Autistic people like routine and get into habits easily. One habit may be the way they eat. Some autistic people choose their food based on smells and texture instead of taste. Some eat the same food at the same time, all the time for months and months. They may eat at the same time every day without fail, or shop for groceries in the same direction, speed, and process each time they shop. Autistic people also tend to have a special interest or passion that they become absorbed in. There's an emotion attached to a special interest. It's a positive emotion, an emotion of well-being. I knew of a boy around 12 years old who suddenly became interested in fish. He was able to get himself a fish tank, and he talked about fish all the time. He knew the family, genus, species, etc. He knew the Latin names and the common names. He started breeding fish, selling them, going to people's houses and diagnosing problems with their fish and their fish tanks. And by the time he was done his special interest in fish, he had 17 fish tanks at his house. And then he was done. And it had lasted a few years, and then he was on to another one soon. The vocabulary and language of autistic people without an intellectual disability can be expansive and literal. Autistic people have customs that differ from mainstream society, such as stimming, not talking on the phone, and not participating in small talk. Autistic people have etiquette that may seem strange. They are very honest. They may not participate in telling white lies. They may like to know the names and places that they're going to meet instead of being vague and saying, let's get together sometime. Mores and norms for society are all the unwritten rules which bring about an ease and comfort in communicating with each other. They're concepts like friendships, being honest, fairness, fitting in with others, avoiding bullies, and working effectively in groups. Non-autistic people seem to know just what to do. Autistic people have always felt they did not get a copy of those unwritten rules. For autistic people, friendships are confusing. Honesty means blatantly honest. Fairness is very important, and we need to mask who we are to fit in with others. We tend to be extra vulnerable to bullies, and it's difficult to work effectively in groups for various reasons.
So to reiterate, there's a social organization of normalized behaviors, language, and sensory experiences. Whereas many autistic people mask to fit into the mainstream, usually at a great cost physically and mentally to themselves. When amongst other autistic people, they're able to take that mask off and just be autistic. They are among validating samehood. They can enjoy stimming without judgment. They can sit in the dark, wear what's comfortable, use words like same food and infodump, and avoid sensory hell. They can be audi-gendered autists if they want to be, and nobody questions them. Also, within a group of autistic culture people, they understand that slide as pie that we showed you. The fact that an autistic person is okay 1 minute and not okay the next is just that, okay. Things like regulating rooms are not a big deal within the autistic culture. They're understood without judgment or other thought. A person goes into a room, they regulate as necessary, and they come out competent to do what they need to do. It's no big deal for them. And next, as Lisa said earlier, autistic people generally have no use for small talk. They speak plainly without metaphor, and they might even communicate without words. They attend to detail like no mainstream person can and spread joy in unique ways. They are the same and dynamic. And most importantly, in terms of culture, is humility. Understanding even a fraction of what we're presenting today, which is really just the tiniest tip of the iceberg, takes not just cultural competency, but cultural humility. When treating autistic patients, providers need to check in with themselves, adjust their goals, and use strategies that usually work for autistic people, thus helping the patient to trust them in an extremely unsafe world. This will require mainstream structures to recognize the need to let go of established norms. So in an effort to help you understand more about the autism culture and give you a head start into helpfully assisting your clients in validating ways, let's learn about specific areas of challenge for autistic people.